What's up, beautiful people? Another day, another study, another dementia study, one of my favorite topics to discuss because we're seeing more and more literature about how preventative many cases of dementia can be. And my practice focuses a lot on risk mitigation and prevention through cardiometabolic health. And that's exactly what we're talking about today. So we know dementia is the seventh leading cause of death and is a major cause of disability. Risk factors for dementia include things like less social connectivity, low physical activity, non-nutritious diets, air pollution, smoking. And we know cardiometabolic disorders like diabetes, hypertension, high cholesterol, heart disease, stroke. These are risk factors for developing dementia. This study was looking at Medicare beneficiaries who have cardiometabolic diseases and looking at the association with dementia. And those metabolic diseases were things like diabetes, heart failure, stroke, hypertension. And they found that stroke, heart failure, and hypertension had the highest increased risk of developing dementia, while hyperlipidemia had the lowest. The difference between the highest and the lowest was stroke had 123% increased risk versus hyperlipidemia was a 27% increased risk. Then they did the population attributable factor, which is a number that looks at how many cases of a particular disease can be attributed to a condition. And in this case, 37.4% of the dementia cases were attributable to those 8 cardiometabolic diseases I mentioned, with hypertension being the highest at nearly 10%, and ischemic heart disease and heart failure following after that. Their statistical modeling, they estimated that a 15% reduction in all 8 risk factors will reduce dementia cases by 6.6%. So this was an observational case control study, and it relied heavily on statistical modeling, but it's just further evidence that we see in clinical studies 30 to 40% of dementia cases are probably preventable through these modifiable risk factors. And that's why it's so important to start working on these things early and prioritize cardiometabolic health when it comes to brain health.